Thanks for staying with DT India. You're watching Newsnight. I'm Sakal Bhatt, and our top story is going to be government stepping up the efforts and apparatus to beat pandemic, and most importantly, Prime Minister making those important announcements in the COVID address to the nation, which just concluded a short while ago, reassuring the nation that there is no question of lockdown. Lockdown is something which is the last option, but the government is committed in terms of accelerating the production of vaccines as well as oxygen supply, and also the welfare of downtrodden. That is also one of the top priorities of the government, where Prime Minister reached out to the migrant workers and the workers' workforce, telling them stay where you are. There's no need to move out. We're going to talk about all that in this edition of Newsnight, plus other stories that we are tracking for you. But first up, the headlines on Newsnight. Prime Minister Narendra Modi addresses the nation on the issue of spiraling cases of COVID, says lockdown in any part should be last option, calls for patience while assuring that every possible effort is being done to mitigate the sufferings, calls upon all the state governments to ensure that the daily wage labourers are least affected due to restrictions. Government steps up fight to beat pandemic and arrest the chain of COVID infections. Prime Minister holds meeting with top vaccine manufacturers. Bharat Biotech augments production capacity to 70 crore doses annually. Defence Minister Rajnath Singh speaks to Army Chief General M.M. Narwane. Defence Secretary and DRDO Chief directs to open all military hospitals and military medical establishments for civilians battling pandemic. In other news, Union Health Minister Dr. Harshvardhan holds video conference with AIIMS officials across the country to discuss surge in COVID cases, stresses the need for caution but advises against unnecessary panic, adds mortality rate has declined with only 1.7% patients on ventilator. Centre has said that the steps taken in recent days by the NDA government under the leadership of Prime Minister Narendra Modi has full support of the industrial houses and associations. Replying to a question, Union Minister Piyush Goyal said that the associations are satisfied with the decisions and government is doing everything it can to ensure a continuous economic activity. Railway Minister Piyush Goyal has said migrant workers need not panic at railway stations while ensuring availability of tickets. Railways, meanwhile, to start 5 additional trains for Bihar in 2 to 3 days. Meanwhile, Maharashtra ministers indicate the state is all set to bite the bullet for a full lockdown. Chief Minister Uddhav Thackeray to make formal announcement on Wednesday. In a relief to UP government, Supreme Court stays the decision of Allahabad High Court to impose complete lockdown in 5 COVID-hit districts of UP. In international news, Indian ambassador to China says tendency to characterize situation at India-China border as minor issue is inadvisable. Says this will only take the two countries further away from a sustained solution. And amidst growing tensions between Russia and America, Washington's envoy to Moscow will return to the United States for consultations with US President Joe Biden. And this comes close on the heels of Moscow recommending that Ambassador John Sullivan temporarily leave amid soaring tensions between Russia and US. And top story on Newsnight. Prime Minister Narendra Modi has called the option to impose lockdown and similar restrictions to be seen as the last resort. In an address to the nation, Prime Minister said that the nation has to be safe from lockdown and in the fight against corona. He further advised states to concentrate on identifying micro-containment zones to defeat the second wave of this deadly virus.
आज की स्थिति में हमें देश को लॉकडाउन से बचाना है। मैं राज्यों से भी अनुरोध करूंगा कि वो लॉकडाउन को अंतिम विकल्प के रूप में ही इस्तेमाल करें। लॉकडाउन से बचने की भरपूर कोशिश करनी है और माइक्रो कंटेनमेंट जोन पर ही ध्यान केंद्रित करना है। हम अपनी अर्थव्यवस्था की सेहत भी सुधारेंगे और देशवासियों की सेहत का भी ध्यान रखेंगे।
Expressing gratitude to the frontline warriors or frontline workforce, Prime Minister Modi hailed the efforts of all essential workers, including doctors, pharma-medical staff, sanitization workers and security personnel for their immense contribution and service to the nation. In fact, Prime Minister Modi has urged countrymen to exercise patience to defeat the second wave of coronavirus in the country.
जो पीड़ा आप सह रहे हैं उसका मुझे पूरा एहसास है। जिन लोगों ने बीते दिनों में अपनों को खोया है, मैं सभी देशवासियों की तरफ से उनके प्रति संवेदनाएं व्यक्त करता हूं। परिवार के एक सदस्य के रूप में मैं आपके दुख में शामिल हूं। चुनौती बड़ी है, लेकिन हमें मिलकर अपने संकल्प, अपने हौसले और तैयारी के साथ इसको पार करना है। मैं देश के सभी डॉक्टरों, मेडिकल स्टाफ, पैरामेडिकल स्टाफ, हमारे सभी सफाई कर्मचारी भाई बहन, हमारे एम्बुलेंस के ड्राइवर्स, हमारे सुरक्षा बल, पुलिसकर्मी, सभी की सराहना करूंगा।
And on the issue of oxygen demand, Prime Minister said that we are working on a war footing to ensure availability of adequate oxygen and bed availability, COVID bed availability in hospitals. Prime Minister in fact said that through proactive steps taken by the centre over the last few days, private sector has also been roped in the process.
इस बार कोरोना संकट में देश के अनेक हिस्से में ऑक्सीजन की डिमांड बहुत ज्यादा बढ़ी है। इस विषय पर तेजी से और पूरी संवेदनशीलता के साथ काम किया जा रहा है। केंद्र सरकार, राज्य सरकारें, प्राइवेट सेक्टर, सभी की पूरी कोशिश है कि हर जरूरतमंद को ऑक्सीजन मिले। ऑक्सीजन प्रोडक्शन और सप्लाई को बढ़ाने के लिए भी कई स्तरों पर उपाय किए जा रहे हैं। राज्यों में नए ऑक्सीजन प्लांट्स हो, 1 लाख नए सिलेंडर पहुंचाने हो, औद्योगिक इकाइयों में इस्तेमाल हो रही ऑक्सीजन का मेडिकल इस्तेमाल हो, ऑक्सीजन रेल हो, हर प्रयास किया जा रहा है।
Prime Minister has also said that pharma sector is also in the forefront in battling COVID-19 pandemic.
देश के फार्मा सेक्टर ने दवाइयों का उत्पादन और बढ़ा दिया है। आज जनवरी-फरवरी की तुलना में देश में कई गुना ज्यादा दवाइयों का प्रोडक्शन हो रहा है। इसे अभी और तेज किया जा रहा है। कल भी मेरी देश की फार्मा इंडस्ट्री के बड़े जो प्रमुख लोग हैं, उसके जो एक्सपर्ट लोग हैं, उनसे बहुत लंबी चर्चा हुई है। प्रोडक्शन बढ़ाने के लिए हर तरीके से दवाई कंपनियां की मदद ली जा रही है। हम सौभाग्यशाली हैं कि हमारे देश के पास इतना बड़ा मजबूत फार्मा सेक्टर है जो बहुत अच्छी और तेजी से दवाइयां बनाता है।
Prime Minister also called upon the state governments to urge the migrant workforce to stay where they are, and this trust given by the states to the workers will help them, and that they will be vaccinated in the city wherever they are.
प्रयास से भी ये है कि आर्थिक गतिविधियां और आजीविका कम से कम प्रभावित हो। प्रयास का तरीका यही रखा जाए। वैक्सीनेशन को 18 वर्ष की आयु के ऊपर के लोगों के लिए ओपन करने से शहरों में जो हमारे वर्कफोर्स है उसे तेजी से वैक्सीन उपलब्ध होगी। राज्यों और केंद्र सरकार के प्रयासों से श्रमिकों को भी तेजी से वैक्सीन मिले लगेगी। मेरा राज्य प्रशासन से आग्रह है कि वो श्रमिकों का भरोसा जगाए रखे। उनसे आग्रह करें कि वो जहां हैं वहीं रहे। राज्यों द्वारा दिया गया ये भरोसा उनकी बहुत मदद करेगा कि वो जिस शहर में हैं वहीं पर अगले कुछ दिनों में वैक्सीन भी लगेगी और उनका काम भी बंद नहीं होगा।
Prime Minister also requested various media channels for responsible reportage so as to not create panic amongst people.
प्रचार माध्यमों से भी मेरी प्रार्थना है कि ऐसे संकट की घड़ी में वो लोगों को सतर्क और जागरूक करने के लिए जो प्रयास कर रहे हैं उसे और बढ़ाएं। इसके साथ ही इसके लिए भी काम करें कि डर का माहौल कम हो सके, लोग अफवाह और भ्रम में न आए।
And to discuss the larger message of Prime Minister's COVID address, which recently concluded, we are joined on Newsnight by Dr. N.N. Mathur. He's joining us. Dr. N.N. Mathur is Director, Lady Haring Medical College. And also we are joined by Professor G.C. Khilnani, former head of the Department Pulmonary Medicine from AIIMS. Khilnani ji, namaskar to you, and thank you both of you, Dr. Mathur and Dr. Khilnani ji, yes, to join us on the show. I'm going to start with Dr. Mathur. I'm sure you heard that address by Honorable Prime Minister, very reassuring, and that's the Prime Minister of the country leading the COVID fight from the front, especially addressing those sticky issues that matter the most, where the nation would really wanted to know. There were a lot of anxiety whether there's going to be a lockdown or not, and the oxygen supply or the lack of it, the vaccination production, etc. Quickly, your remarks. What do you make of the larger messaging? Prime Minister reaching out to the countrymen, trying to tell them that it is not that bad and we are at it. We will succeed at the end of the day, and India is in the right direction. Even if the second wave, Prime Minister used the term second wave, hit the nation like a storm.
Absolutely. The Prime Minister of the country, Shri Narendra Modi ji, has just now addressed the nation, and we very much needed as countrymen to listen to him, because the surge has been so steep in last 1 week that though we anticipated the second wave to be very bad, but never anticipated that to be that steep. And it has caused a lot of anxiety amongst not only the people, public, but even the treating physicians, nurses, and staff. Many of the healthcare workers have been affected very badly this time. This was probably not that much bad one in the first wave. Prime Minister, leading from the front,
Yes, sir.
has done a tremendous job today, and we are so very grateful to him.
Okay. Yes. And let me take the thought to Professor Khilnani here on the show. In that speech that lasted roughly for over 20 minutes, almost 20 minutes, especially on the point of government doing everything possible to accelerate vaccine production and to also boost oxygen supply, boost the rising demand for oxygen. Those 2 points, as a medical practitioner, in the second wave, these were 2 mega concerns. Do you think Prime Minister has adequately, the government of the day has adequately addressed these 2 issues?
There have been serious concern,
Yes.
occurring because of shortage of oxygen in some parts of the country. So therefore, there is a serious fear among the masses that if I become ill, will I get the oxygen in the hospital? Will there be adequate supply in the oxygen? And we know that in COVID treatment, the mainstay of treatment remains adequate oxygenation. So therefore, the Honorable Prime Minister, in no uncertain terms, assured the country that there will be no shortage of oxygen. It will be, the production of the oxygen will be enhanced by all means. That is one part of it. Second part is that there have been a lot of hesitancy and misconceptions about the vaccinations all over the country. The initial hesitancy was actually removed when the Prime Minister himself got vaccination, and the safety of vaccination was sort of assured to the masses. But second part is the quantum of vaccination. Unless we vaccinate the large proportion of population, the transmission is not going to stop. And in the recent past, there have been concerns about the supply of the vaccine. There have been concerns about inadequacy of the number of vaccines being supplied. So this was a big reassurance.
Okay.
And then there was a big demand for vaccinating the younger people below the age of 45 years, starting from 18 years, because these are the workforce. These are the people who travel. These are the people who party. These are the people who are providing service also. And by virtue of that, they have a potential of not only transmitting and suffering also. And the recent surge, we have seen that a lot of younger people are having not only disease, but the serious disease. So it is a need of the hour to vaccinate these people so that they are protected from the disease, and in turn they will also not be transmitting the disease. So this is an absolutely welcome step to decide to vaccinate and open up the vaccination for all the adults above the age of 18 years.
Yes.
Besides the government's decision to open up the vaccines, that means that other vaccines other than the Covishield and the Covaxin coming into the Indian setup, and also providing vaccine, those who can pay can look for other vaccines also. So it's sort of a government and private partnership which will come and which will enhance the proportion of people being vaccinated. Those people who are having hesitancy in going, and the government places can get privately vaccine. After all, we have been vaccinating ourselves with flu and hepatitis by buying vaccine. If that kind of thing comes true in India soon enough, the vaccination drive will definitely be enhanced, and this is what was promised by the Prime Minister. All this is combined. The Honorable Prime Minister has instilled confidence into Indian population that government of India is in control of the situation.
Yes.
And government will
that confidence.
No stone unturned to control this.
Yes, Dr. Mathur, that confidence that the government of the day is in absolute control of the situation, and it is time to end the cynicism and come together, irrespective of the political alignments, come together and fight this out. Do you think that was also the part of the message? Because Prime Minister specifically mentioned, he addressed that aam janta anxiety ki lockdown hoga ya nahi. So you have the Prime Minister saying that lockdown is the last option, lockdown is the last option. I think it couldn't be clearer than that the government understands that lockdown not only hits the economy, it hits a common man first and then economy, of course.
Absolutely. The Honorable Prime Minister was very clear in what the message should go across. He enumerated various measures that the government has taken and the plans ahead. The biggest plan which has been rolled out is the vaccination of everyone above 18. And he also emphasized that while we fight this disease at different level, the lockdown should be the last resort because it hits us badly economically. But as a last resort, whenever it is required, it will be required. And to that, the government is very clear, but it will be the last resort. And he emphasized on, as far as possible, resorting to micro-containment zones. And that had been the policy of the government so far also. And he wants continue with the same policy of micro-containment zone and lockdown as a last resort.
Yes, let me come to that vaccine for all announcement made by the government yesterday, and Prime Minister has had series of meetings in the last 24 hours, specifically Dr. Khilnani, if you look at whether it was reaching out, to the top pharma companies. Today also he had an interaction with the top pharma leaders in the country. This vaccine for all, the rationale behind it and how this is actually going to turn the tables, because no matter what, we are still leading the world's largest vaccination drive. Now opening this up for 18 and above, do you think it's a big shift?
So what are the aims of vaccine? That we need to understand. Aims of the vaccination is two. One, to protect an individual from infection so that he does not suffer and severe disease does not occur. Second is to develop herd immunity. What is herd immunity? When the 60 to 70% of the population in a community becomes resistant to infection, the transmission stops. Then how do you achieve that? You can either achieve by suffering from COVID infection, which has a mortality of 1.5% approximately even today, or you vaccinate yourself. And if you combine these two, and if you are able to achieve a zero prevalence of 60 to 70%, then only you can stop the chain of transmission. So in view of that, when you have 100 rupees in your pocket, you should know how to spend it depending on the priority. Like you first look into your food and all those things, then you go to other things. Similarly, the government, not only Indian government, but the Western developed countries who are rich countries like United States and United Kingdom, they first vaccinated their elderly people and then with people with comorbidities, and they have now started vaccinating their younger people. The vaccination of younger people is likely to be faster because
Yes.
they are mobile, they will be able to procure vaccine, they will be able to reach the vaccination centers, and if they attain immunity, they would not suffer from the disease, they would not transmit the disease. This is a very, very big step to attain a zero prevalence or the herd immunity in the country. I do understand it is going to take a few months.
Okay.
But this is the major step in combating this dangerous pandemic. Thank you.
Okay, stay with us. Dr. Mathur, that point made by Health Minister today when he was interacting with the AIMS officials across the country, that the mortality rate has come down. And I think at this juncture, this is a very encouraging news. Although it's very appreciating the way some of the states have actually taken the call and gone for a weekdays or weekend lockdowns, depending on the number of cases that they are dealing with. But if you could just, explain this a bit. The situation is not all that bad, or because there's a lot of comparison that comes between wave 1 and wave 2.
The difference between the wave 1 and wave 2 is that wave 2 we have got the experience of wave 1, and the wave 1 we didn't know much about the disease, but in the wave 2 we have pretty good experience about how does this disease behave, how to tackle it, and therefore he was talking about the experience that we have gained and the doctor's experience in this in the last 1 year, that we are better able to manage these patients now. And so that was reiterated by the Prime Minister. And I think that is the biggest message. And even we as the clinicians and the doctors feel that our knowledge of the disease, though it's an unknown disease, we still do not know many things about it, but still we know much more than what we knew about a year back.
Okay, Dr. Kilani, would you like to add to that?
Yeah, I would like to add, if you're going into the history of this COVID, in Italy there was 15 to 20% mortality in people about 75 years of age. The UK had high mortality, and India too had 3 to 4% death rate. How it has come down? It has not come down naturally. It has come down because we have understood the disease, the facilities have been enhanced, new centers have been created overnight, ventilators have been procured, the centers have been dedicated for COVID care, and over and above, we doctors are trained now, trained to look after these people. I know people died while on the way, reaching the hospital, because they didn't know that they are having low oxygen. And today, if somebody has got COVID, first thing is acquired is the oxygenation probe, which is widely available. At one time, some governments even gave free oxygen probe. So all these things, including the drugs, including the infrastructure, including the awareness on the part of public, all these things adding together, the mortality in India has come down to very, very low, I would say, and it is probably one of the lowest in the world. And for that, the credit goes to the government providing the infrastructure, awareness, and also the healthcare workers. I'm not talking about doctors because I am a doctor, but our staff nurses.
Yes.
The sweepers, the ward boys.
Yes.
They have actually sacrificed and looked after the patient.
And
Our
Prime
ambulance
Minister,
drivers.
yes, and Prime Minister, and this is not for the first time that Prime Minister has specifically mentioned about these frontline workers. In fact, Asha Anganwadi, in his address today also, there was specific mention of these workforce specifically that you're pointing out.
Yeah, absolutely. So this cadre of people, other than the doctors, should be applauded by one and all, because they are the ones who are actually touch the patient. They are the ones who carry the patient. Those are the ones who bring the patient to the hospital. The sweeper who sweeps the COVID ward is a tremendous risk, and we know about it. So all this has brought down a comprehensive care of COVID patient, which we have learned. But having said that, the final onslaught on the COVID will come from the vaccination. Thank you.
Yes, and as far as that vaccination bit is concerned, I think we are on the right course, as reiterated by Honorable Prime Minister. Thank you very much, Professor G.C. Khilnani and Dr. N.N. Mathur for joining us on Newsnight. Thank you. And staying with the top story on Newsnight, Prime Minister Narendra Modi earlier today interacted with vaccine manufacturers from across the country via video conferencing. He applauded the vaccine manufacturers for their achievements and professionalism, saying that biggest strength of our vaccine industry are its samarthya, sansadhan and seva bhav. And these are what makes them a vaccine leaders in the world. Believing in the ability of our vaccine manufacturers, Prime Minister Modi said government has now allowed the vaccination program for every adult starting 1st of May. He urged the vaccine manufacturers to continuously scale up the production capacity to vaccinate people in the shortest possible time, also appreciating the efforts and studies being conducted by scientists in development of these new vaccines. Prime Minister Modi credited them for developing and manufacturing vaccines in record time. He also assured all possible support and smooth approval process for the vaccine candidates which are currently under trial phase. Prime Minister said the health infrastructure of a private sector has played a big role in the country's fight against COVID-19, and in the coming days the private sector will play an even more active role in vaccination drive. The vaccine manufacturers thanked Prime Minister for the government's decision of allowing vaccination for everyone above the age of 18. They also appreciated the Prime Minister's leadership or the support they have received from the Government of India throughout the process of vaccine development and production. Also discussed their plans to ramp up production, upcoming vaccine candidates and research on the new variants. In fact, Secretary General of FICCI, Dilip Shenoy, has lauded Prime Minister's vaccination initiative of vaccinating 18 years and above.
जो प्रधानमंत्री ने जो निर्णय लिया था और पूरे जो देश में 18 साल से आयु के ज़्यादा जो व्यक्ति हैं उनको वैक्सीनेशन मिलेगा, ये एक बहुत ही महत्वपूर्ण कदम है। प्रधानमंत्री ने कल की बैठक में और भी निर्णय लिए थे, जैसे हॉस्पिटल्स और पूरे जो स्टेट्स हैं वो वैक्सीन मैन्युफैक्चरर से खुद अपने वैक्सीन प्रोक्योर कर सकते हैं। वैक्सीन मैन्युफैक्चरर्स को अपना प्रोडक्शन इंक्रीज करने के लिए इंसेंटिव देने के लिए और एक तरीके से ये पूरा जो वैक्सीनेशन का जो प्रोसेस है उसको एक्सेलरेट करने का जो निर्णय था, बहुत ही अच्छा निर्णय था। इंडस्ट्री इसका स्वागत करती है, फिक्की इसका स्वागत करती है और हमारा ये मानना है कि अगले 2 या 3 महीने में ये वैक्सीनेशन का एक जो जोर पकड़ेगा और इम्यूनिटी बढ़ेगी और इकोनॉमिक एक्टिविटी को वापस लाने में काफी मदद करेगी।
Meanwhile, all states, especially those that have witnessed sudden surge in positive cases, COVID positive cases recently, have chosen to go in a lockdown mode, but in a phased manner. This is, of course, in a bid to break the chain of infection. Almost all states have a concerted focus on ramping up testing infrastructure, larger containment zones, strict enforcement of COVID-appropriate behavior. In fact, the union territories have also been advised to plan the augmentation of hospital infrastructure in advance for the next 3 weeks. We have a detailed report which actually talks about different strategies being adopted by different states to deal with the pandemic situation.
Amid the spike in COVID-positive numbers, Uttar Pradesh government on Tuesday announced a weekend lockdown across the state to combat the second wave of COVID-19 pandemic, along with the imposition of night curfew in districts with over 500 active cases. Lockdown will come into effect on Friday at 8 p.m. and will continue till 7 a.m. Monday. Only essential services, including those associated with health and vaccination, will be allowed to operate during the lockdown. Reiterating that government will ensure the corona curfew does not impact the livelihood of the common man, Uttar Pradesh Chief Minister Yogi Adityanath has appealed to the people to cooperate in enforcement of the weekend lockdown to arrest the spread. In a related development, Supreme Court on Tuesday put on hold the Allahabad High Court order for a week-long lockdown until 26th April in 5 Uttar Pradesh districts: Prayagraj, Lucknow, Varanasi, Kanpur, Nagar and Gorakhpur districts, which are reporting a sharp spike in COVID-19 cases. Refusing to implement the High Court order passed on Monday, Yogi Adityanath-led UP government challenged it in the Supreme Court. Slamming Delhi Chief Minister's decision of imposition of 6-day lockdown in national capital Delhi, Cabinet Minister in UP Siddharth Nath Singh said the decision was taken in haste and migrants are being abandoned at the borders.
दिल्ली के मुख्यमंत्री ने फिर से वही फेज 1 की तरह उन्होंने फिर से महामारी के दौरान यूपी और बिहार के साथ वही रवैया दिखाया जो उन्होंने पहले दिखाया था। आनन फानन में जब लॉकडाउन लगाते हैं बिना तैयारी के और अपनी विफलताओं का पर्दा डालने के लिए लॉकडाउन लगता है, तो इसी प्रकार से व्यवस्था चरमराती है और लोग परेशान होते हैं। उत्तर प्रदेश के मुख्यमंत्री ने कल रात में उत्तर प्रदेश की बसें लगाकर, सरकारी और प्राइवेट लगाकर 70 से 1 लाख लोगों को वहां से निकालने का कार्य शुरू कर दिया है और उनको अपने गांव तक की पहुंचाने का कार्य कराया जा रहा है।
In Jharkhand, important steps have been taken to arrest the chain of infections, stating that the government's priority is to save both lives and livelihoods. Jharkhand government on Tuesday announced a week-long lockdown starting 22nd April at 6 a.m. to 29th April 6 a.m. with certain relaxations. The lockdown week starting 22nd April has been marked as Swasthya Suraksha Saptah, where all shops barring essential ones will remain shut. The CM said only a few central state sectors and private offices will remain open. However, industries, construction, agricultural and mining activities will continue in the state.
स्वास्थ्य सुरक्षा सप्ताह के माध्यम से हम कोविड-19 के चेन को ब्रेक करने में सफल होंगे। आवश्यक सामग्री की दुकानों को छोड़कर अन्य सभी दुकानें बंद रहेंगी। कोई भी व्यक्ति अनुमति प्राप्त कार्यों को छोड़कर अपने घरों से बाहर नहीं निकलेंगे। कोरोना संक्रमण को जन भागीदारी से ही रोका जा सकता है।
In Gujarat, Chief Minister Vijay Rupani and Deputy Chief Minister Nitin Patel took stock of the COVID situation with the state administration. Instead of adopting lockdown strategy, the state government is focusing on firming up the health apparatus. The CM has said that within a month, COVID bed capacity has been augmented from 41,000 to 78,000. He has given instructions to the concerned department to add 100,000 additional beds by 30th April.
जिस तरीके से ये दूसरी लहर उठी है, तो 15 मार्च की जो स्थिति थी, पिछले एक महीने में हमने 41,000 बेड में से 78,000 बेड आज कर दी है और आने वाले 30 अप्रैल तक और 10,000 बेड हम बढ़ाएंगे। ऑक्सीजन की जो मात्रा है वो भी बढ़ी है, तो ऑक्सीजन बेड हमने बढ़ाई है, इसलिए मात्रा बढ़ी है। 15 मार्च पे जितनी बेड थी उससे दुगनी बेड यहाँ कर दी है और मैक्सिमम प्रयत्न हम लोग कर रहे हैं। गुजरात गवर्नमेंट ने काफ़ी कदम उठाए हैं, जिसमें 10 घंटा का कर्फ्यू, 24 घंटे में से 10 घंटा यानी कि आधा दिन कर्फ्यू 20 शहरों में हमने लागू किया है।
In Kerala, state government has decided to impose a 2-week night curfew from 9 p.m. to 6 a.m. from Tuesday. The decision was taken at the core committee meeting called by Chief Secretary. Public transport and goods movement will be exempted from the curfew. In Tamil Nadu, government has announced fresh restrictions, including night curfew from 20th April and total curfew on Sundays to curb the rising COVID-19 cases. The night curfew will be enforced from 10 p.m. to 4 a.m. The administration has pressed for strict implementation of COVID protocol. District administration has slapped legal action on at least 4 lakh people for not wearing masks since 8th April. Amid an upsurge in COVID-19 cases, some northeast states have reimposed restrictions. While Manipur has imposed a night curfew, Meghalaya has put restrictions on social and religious gatherings. In Shillong, schools will remain closed from 20th April to 4th May, while some strict curbs on tourists and 50% attendance in government offices. Bureau Report, DD India.
And amidst a huge surge in COVID cases in Maharashtra, the state government has given enough indications that it may finally have to take a call to induce lockdown in the state to arrest the spiraling numbers there. In a state cabinet meeting, all the ministers have requested Chief Minister Uddhav Thackeray to impose a lockdown in the COVID-hit state. A decision will be announced by Uddhav Thackeray on Wednesday evening.
कल रात को 8 बजे के बाद लॉकडाउन के बारे में माननीय मुख्यमंत्री जी ने निर्णय लिया है, लेकिन उसकी घोषणा वे स्वयं करेंगे और उसके बारे में वे स्वयं उसके बारे में निर्णय लेंगे। मंत्रिमंडल ने उनके ऊपर पूरा सौंपा है, लेकिन मंत्रिमंडल ने एकजुट होकर एक ही मांग की है कि लॉकडाउन बहुत स्ट्रिक्टली होना चाहिए।
And the centre on Tuesday advised union territories to ramp up testing for COVID-19 and also augment laboratory and hospital infrastructure to prepare for the next 3 weeks, keeping in view the critical situation across the country. And these were conveyed to top officials of the union territories at a review meeting by Union Home Secretary Ajay Bhalla and Union Health Secretary Rajesh Bhushan. Meanwhile, all arms of the government and concerned ministries are also working on war footing to help state governments firm up their health apparatus, especially for the worst affected states. Take a look at this report.
Drawing from the experience of tackling the COVID-19 pandemic in its earlier wave, Centre is proactively engaged in tackling the country's second wave of infections. All ministries are now working in tandem and supporting the fight against the pandemic in every possible way. Raksha Mantri Rajnath Singh has asked the 3 service chiefs to utilize additional capacity and resources to provide relief to people. He gave instructions to utilize defence medical facilities to treat civilian people for COVID-19. He also said that whatever requirements are needed will be provided through emergency purchases. Singh urged to enhance the oxygen availability for both defence and civilian purposes. Further, he suggested to engage retired medical officers to enhance manpower to tackle the alarming COVID-19 numbers. The DRDO is in the process of setting up and reactivating COVID hospitals in 5 cities of Delhi, Lucknow, Ahmedabad, Patna and Nashik. Further, the DRDO has also supplied 150 jumbo cylinders of oxygen to the Uttar Pradesh government, while 1,000 more cylinders will also be delivered. The Ministry of Railways has clarified that there is no rush at the railway stations and trains are running normally. Railways Minister Piyush Goyal rebutted claims that migrants are distressed at railway stations. The Railways Minister informed that tickets are available and special trains are being run at the moment and more trains will run if need be.
ऐसा कोई रेलवे स्टेशन नहीं है देश में जहां प्रवासी मजदूर बड़ी संख्या में आए हों या उनको तकलीफ हुई हो। मैं पर्सनली भी मॉनिटर कर रहा हूं और चेयरमैन और सभी जीएम्स डीआरएम्स पूरी निगरानी रखे हुए हैं और किधर भी अगर ऐसी स्थिति आती है तो हम तुरंत स्पेशल ट्रेन भी कई जगह से चला रहे हैं। आज की तारीख में अभी मैंने आज लगभग 1 घंटा पहले भी रिव्यू किया है, ऐसा कोई स्टेशन नहीं है जहां प्रवासी मजदूर गाड़ी पे आ रहे हैं। उल्टे हमारी गाड़ियों में बहुत टिकटें अवेलेबल हैं, तो लोग टिकट बुक करके आराम से जहाँ जाना चाहे जा सकते हैं। और क्योंकि ट्रेनें चालू हैं तो मुझे लगता है लोगों को आज कोई चिंता की बात नहीं है, कोई डर नहीं है, किसी प्रकार का कोई लॉकडाउन नहीं है और ट्रेन चल रही है और आगे भी चलती रहेंगी।
The Northern Railways has planned 5 more special trains for Bihar during the next 3 days. Apart from transporting essential commodities and keeping the supply chain intact even during the lockdown last year, the Railways has now geared up to run oxygen express rakes to ease the shortage of oxygen in many cities. First oxygen express rakes has already left Mumbai region for Vizag, where liquid medical oxygen will be loaded on the trucks. Meanwhile, Ministry of Labour and Employment has rejuvenated the 20 control rooms that were set up in April last year to mitigate the problems of migrant workers. The functioning of all the 20 call centres is being monitored and supervised by the Chief Labour Commissioner on a daily basis.
पिछले कुछ दिनों में कुछ राज्यों में लॉकडाउन की प्रक्रिया शुरू हुई है। इसको देखते हुए श्रम मंत्रालय ने फिर से जैसे पिछले वर्ष अप्रैल 2020 में 20 कंट्रोल सेंटर शुरू किए थे, हमने फिर से आज से ये ऑर्डर निकाल दिया है और ये सारे के सारे 20 कंट्रोल सेंटर विविध राज्यों में कार्यान्वित किए गए हैं। इनमें सेंट्रल लेबर कमिश्नर के अधिकारी उपलब्ध रहेंगे। सबके नंबर हमने उपलब्ध करा दिए हैं। किसी भी माइग्रेंट वर्कर को कोई भी जरूरत हो, राज्य शासन से या किसी भी तरह की कोई आवश्यकता हो और उनसे कोई मदद की जरूरत हो तो हमारे अधिकारी उपलब्ध रहेंगे और उनको मदद पूरी कराएंगे, ये हमारा आश्वासन है। इसके साथ ये सब जिसको कैसी भी जरूरत हो माइग्रेंट वर्कर को, वो हमारे अधिकारियों से संपर्क करें और इन सेवाओं का लाभ लें।
Union Home Secretary reviewed the status of COVID-19 containment in all union territories on Tuesday. Ramping up testing, movement restriction and urgent review of clinical management was strongly recommended. The UT administrators were advised to plan augmentation of hospital infrastructure in advance for the next 3 weeks. For the next 3 weeks remain critical for mitigating COVID-19's second wave in the country. Bureau Report, DD India.
Meanwhile, Union Health Minister Dr. Harshvardhan held a video conference with the officials of all India Medical Sciences, that's AIIMS in India, on the issue of surge of COVID cases across the country. And during this interaction, he stressed on the need to exercise caution due to surge, but also advised against any unnecessary panic.
अभी इस बार के 2 महीने में एक बात ध्यान में आ रही है कि बहुत लोगों को जितनी तकलीफ नहीं है उससे ज़्यादा उनके मन में बीमारी के प्रति पैनिक है, और वो इसलिए लग रहा है क्योंकि वो केसेस की संख्या तेज़ी से बढ़ रही है। और ऐसे मौके पर उनको सही एडवाइस मिलना, उनकी बात धैर्यपूर्वक सुना जाना, उनको सही ढंग से ये बताया जाना कि आपको इस समय किस चीज़ की ज़रूरत है। आपको अगर हम मान लीजिए अस्पताल में आपको रहने की ज़रूरत नहीं है तो भी उनके साथ डायरेक्ट टेलीफोनिक संपर्क अपनी टीम्स का मेंटेन कराना, यानी नए नए हमारे पास और भी बहुत सारे जो हमने 1 साल में हमने किया, ओवर एंड अबव दैट बहुत सारे और नए इनोवेटिव आइडियाज़ को विकसित करके, जैसे हम पिछली 2020 की चुनौती को सफलतापूर्वक हम उसको ओवरकम कर पाए।
Meanwhile, the cumulative number of COVID-19 vaccine doses administered in the country has crossed 12.71 crore as part of the world's largest vaccination drive. Cumulatively, 12 crore 71 lakh 29,113 vaccine doses have been administered through 18 lakh 83,241 sessions. Over 32 lakh vaccination doses were administered, in fact, in the last 24 hours. Let's take a look at more numbers.
2 वैक्सीन्स भी डेवलप कर ली और आज आप जानते हैं कि आज सुबह की अगर बात करूं तो 12 करोड़ 71 लाख से ज़्यादा लोगों को वैक्सीन डोजेस जो है मिल चुकी हैं।
Meanwhile, India's daily new cases are showing a rising trend. 2,59,170 new cases were registered in the last 24 hours. The 10 states including Maharashtra, UP, Delhi, Karnataka, Kerala, Chhattisgarh, Madhya Pradesh, Tamil Nadu, Gujarat and Rajasthan, they report 77.67% of the new cases. Maharashtra has reported highest daily new cases at 58,924. It is followed by UP with 28,211. While Delhi has reported 23,686 new cases. India's total active caseload has reached 20,31,977. It's now comprising of 13.26% of the country's total positive cases. There is in fact a net decline of 1,02,648 cases recorded from the total active caseload in the last 24 hours. The Delhi positivity rate continues to show an upward trend, although currently it stands at 15.99%. National mortality rate has further fallen to 1.18%. Meanwhile, Centre has said that the steps taken in recent days by the NDA government under the leadership of Prime Minister Modi has full support of the industrial houses and associations. Replying to a question, Union Minister Piyush Goyal said that the associations are satisfied with the decisions and the government is doing everything it can to ensure continuous economic activity.
Incidentally, I've had interaction with FICCI, CII and ASSOCHAM between Saturday and Monday, and all three associations with the widest membership all over India have confirmed that they are completely satisfied with the steps taken by the central government on the COVID front. They had obviously raised the issue about opening up vaccination for their workmen, which has now been announced yesterday. They had also suggested that they would all like to pay and implement the vaccination for their employees. That they would also like to import, if at all it was available, the vaccines. And those decisions have all been taken yesterday, and I'm sure will be very satisfying to all the economic and trade analysts across the country, and will give a big boost to maintaining economic activity.
In other news, Congress leader Rahul Gandhi has tested positive for COVID-19 on Tuesday and is self-isolating at home. The Congress leader tweeted that he has mild symptoms and requested all those who were in close contact with him recently to take all safety protocols and stay safe as well. Wishing the Congress leader quick recovery, Prime Minister Modi tweeted, and I quote, "I pray for the good health and quick recovery of the Lok Sabha MP Shri Rahul Gandhi ji," unquote. That's the tweet from Prime Minister. Former Prime Minister and senior former Prime Minister and senior Congress leader Manmohan Singh had also tested positive for COVID-19 earlier on Monday. In other news, the Cabinet Committee on Economic Affairs, chaired by Prime Minister, has given its approval for the proposal of the Department of Fertilizers for the formulation of exclusive subsidy policy for urea produced through coal gasification route by Talcher Fertilizers Limited. Now, the project shall improve availability of fertilizers to farmers, thereby boosting development of eastern region, and will save transport subsidy for supply of urea in eastern part of the country. It would assist in reducing urea imports to the tune of 12.7 lakh metric tons per annum, leading to savings in foreign exchange. This project will also give a boost to Make in India initiative and Atmanirbhar Bharat campaign.
Today, a second major decision was taken regarding providing exclusive subsidy for urea produced through coal gasification by Talcher Fertilizers Limited. The Cabinet Committee on Economic Affairs, chaired by Prime Minister Modi, has given its approval for a specific subsidy to promote this innovative technology of coal gasification for the first time in India, since India has large coal reserves, but we do not have adequate gas. This effort to convert coal to gas and then gas to urea will truly help India become Atmanirbhar and is an element of the Atmanirbhar Bharat program that Prime Minister Modi has initiated. It will help in the availability of fertilizer for our farmers, thereby boosting the development of eastern region, saving the transport subsidy for supply of urea in Odisha, Bihar, the Jharkhand, the eastern parts of India.
Union Cabinet has also given its approval to Phase 2A, comprising 19.75 kilometer in 13 stations, and 2B consisting of 38.44 kilometers in 17 stations of Bengaluru's Nama Metro at a cost of 14,788 crores. And implementation of the project will provide the much needed additional public transport infrastructure to Bangalore. The project will streamline the urban transportation system in Bengaluru and also provide the people safe, secure, reliable and comfortable public transport.
Today, the Union Cabinet, chaired by Prime Minister Shri Narendra Modi, approved the Bangalore Metro Rail Project Phase 2A from Central Silk Board Junction to KR Puram, and the Phase 2B from KR Puram to the airport via Hebel Junction, comprising a total length of 58 kilometers at a cost of rupees 14,788 crore. This is a project that will have a transformational impact on commuting in Bangalore.
And with that, it's time to wrap up this edition of Newsnight. We will be back tomorrow, same time, 9 p.m. on DD India. Meanwhile, stay with us. Namaskar.
Namaste.